I'm the General Manager worldwide for Microsoft's health business. As you can tell from the accent, I'm not from around here, but I do live in Seattle these days and have been in the States for about 10 years. So most of the comments I'm going to make today are going to be about the US health market, but I'm also very happy to talk about what's going on globally, particularly in this very interesting and expansive space of virtual health. By way of background, I'm not a doc, I'm not an MD by trade. I actually did the first year of medicine at Cambridge and then switched over to do biological and then genetic anthropology, which has turned out to be an interesting topic that's actually been quite useful in this area. Spent some time working for IBM in the UK and then Microsoft, and then moved over to the States about 10 years ago. And really since I've been at Microsoft and running the health business, we've been thinking about what is the right level of altitude for an organization that ultimately creates software platforms, technology platforms, to play in the health world. And we think virtual care is one of those areas where there's a lot more to do than we're doing today. So I'm going to show you some examples of things that are happening in the world today. If I have the opportunity, we'll see how the tech works. I'm going to run back there and show you a short demonstration because we don't have my laptop plugged in up here. And then hopefully we'll have an opportunity to have a little discussion. Hope that's going to be of use to you. Let me start by asking, how many people in the audience today would you say represent, by show of hands, health provider or healthcare provider organizations? Looks like about a third. How many are payer organizations? And you can be both, of course, these days. Great. And what about organizations who are broadly building technology for the health world? You might be developers. Great. Okay, so we've got about a third. Great. I will try and talk to all of those audiences, perhaps not simultaneously. So let's talk a little bit about what's going on in the industry itself. And from a lot of the speakers, and I really enjoyed a lot of the comments that Dr. Ong had earlier, very much in agreement with a lot of the findings and the directions that he was talking about. As we look globally, there are three trends that I see happening across the industry, across the health industry specifically. And I'm going to talk about the health industry rather than the healthcare industry. In my vernacular, healthcare equals hospitals, the traditional market. I'm going to talk about it as we broaden it out into the full market of prevention, management, and social care as well, because I think that's a very important part of the overall discussion. Firstly, clearly the system is becoming more digital. We understand that. We understand also that the work that's gone on to increase the use of electronic medical records, particularly in the US but around the world, is not so much the transformational part of this digitization, but really the foundational one. And I see a lot of the conversations that I've had in the last 12 months, particularly with US companies who've done their Epic or their Cerner or their Allscripts or their McKesson or their Meditech implementations and are now saying, okay, now we've done this and we've got all this, what are we going to do now? Because ultimately, whilst there are important technological projects to do, they haven't fully transformed our organizations based on how we see the market changing. So I'm going to talk a little bit about some of the extra kind of areas and solutions around that I think particular and pertinent to virtual health that are important. Secondly, there's clearly a need to enhance both the patient and the caregiver experience. Technological uptake has been low in the industry, let's just call it as it is. It's getting better, so the solutions that we build, both from a patient and from a caregiver perspective, have to be incredibly intuitive. Frankly, have to be productive and give time back, whereas a lot of the solutions we've seen that have been out there have not done that. And link the patient and the health professional together. I was really interested to listen to Dr. Ong's comments about the gym membership. Before we went into market as a first-party vendor, as Microsoft, of a wearable device, we have a device out there along with a myriad of other devices that are out there. We may talk a little bit about that market at some point. We were very keen to get out there and do something a little bit different. We did some research into the average half-life of most of these devices that are out there today. And the amount that came back was exactly the same, interestingly enough, as the half-life of a gym membership. And that is 2.5 months. So you go, for the first 2.5 months, if you've got one of these devices, you wear it every day. 2.5 months later, you'll probably find yourself picking it up every other day. Another 2.5 months later, you'll probably be picking it up once or twice a week. And a year later, it may well be relegated to the drawer of shame. Now, we asked the question, why is that the case? And the two reasons that came up were very, very meaningful. The first one was that just quantifying myself isn't helping me. I haven't got a pedometer on me today, other than my mobile phone. I know pretty much how many steps I'm going to do without that assistance. What I really need is information that merges my biometric information with information about my schedule, with information about my current state, with information about what's going on atmospherically and in the climate. And it's really bringing all of that data that's going to make a big difference. And I think the same will be the case for really expanding telemedicine into a broader area of virtual care. I'll tell you what I mean by that in a minute. The second reason, if you're interested, was the lack of ability to connect that personal consumer data into the professional network. How do I get that data in a meaningful way with the provenance recognized into all of my professional caregivers, not just my docs, not just into the EMR, but into the broad swathe, the broad teams that are looking after me. And then finally, as a trend, the area of becoming more predictive. This, I think, is probably the area where we have the largest potential and where virtual care is going to play a very interesting piece around not just the management of care, but frankly the prediction and the avoidance of cost and societal and personal burden down the line. Now, the interesting thing about these three is, as we were looking at them, was as a Microsoft employee for 15 years now and for 10 years over here in the States, I've spent a lot of time thinking about we're not a healthcare specialist company. How do I make sense of those things? And our new CEO, Satya Nadella, when he came into the very big shoes that Steve Ballmer had left behind, he started talking about three bold ambitions for the company. Firstly, making computing more personal. Secondly, reinventing productivity and business process. And thirdly, building the intelligent cloud. And as I see them, those three things map very, very closely onto those industry trends that I was talking about. Now, you may ask, what does all this mean for virtual care and for telehealth and telemedicine? And we'll talk about those three different terms in just a minute. Well, the first thing I'm going to say is it's already happening. Disruption is already here. You've voted with your feet. You're at this conference. You're in this business to some extent or other. And the reality of how the system is changing, not just from a cost perspective, but from a citizen perspective and expectation area. We're going to see continuing changes of the system from delivering what you would broadly call care within walls, traditional inpatient and outpatient visits, to care outside of walls, whether that's virtual care and the use of virtual technologies to connect with patients, or the broader use of IoT technologies for managing and intervening in between interactions with the traditional health caregiver system. Broadly, we're calling that care and health without walls. And that move is something which I think hospitals need to understand, but not necessarily be scared of. There's a very interesting viewpoint which I'm going to share in the moment about what a hospital of the future looks like and what is the future of hospitals. Now, the interesting thing, if you're in the business of building applications in this space, is that the size of these two markets is really quite contrasting. The current healthcare IT market per IDC, per Gartner, is around about $58 billion globally. That's how much money is spent on the healthcare IT market. This market, according to RBC Capital Markets, is an additional $88 billion. So there is a huge amount of money being put into the market. A lot of people trying a lot of things out, but not a lot of it happening at scale yet. And so I'm going to talk about some of the reasons why I think that's the case and some of the areas where we can all help to make virtual care and telehealth and telecare a much more standard part of our everyday business. It's an unfair audience to ask this question. I would normally ask the question at this point, how many people in the audience have actually had a real virtual interaction with a caregiver? So I'm going to ask it, but it's kind of unfair because I'm guessing most of you have. Now look, even in this audience, we're probably at 10% of the audience, right? And that's probably higher than the reality, particularly in the US. There are other countries where more of this is happening, and I'll give you some examples. But there's a lot to be done before technology, which is already absolutely available, and incentives which are increasingly available, start getting more broadly adopted. However, things are happening. I think you know when medicine's changing, when Eric Topol talks about this being on the front page of the New York Times. Modern doctors, house calls, Skype chat, and fast diagnosis. And I promise you this isn't going to be a big advert for Skype. It's not going to be a big Microsoft advert. I'm going to be talking to you generically about technologies, but I will show you a few technologies as well. What's also interesting is this whole area of definition, which is changing. In the past, we probably would have talked a lot about telemedicine, right? Gartner hype cycle, and telemedicine was always what they talk about, right? And you'd see where it was going. And it tended to be a very specialized area. It tended to be very focused on clinician to patient interactions. And the reality is that if we broaden that out and start thinking about telehealth is bigger than telemedicine. If you actually look at these predictions of where the virtual interactions are going to be over the next 6 years, there are actually probably going to be more of those interactions happening in a non-clinical setting than in a clinical setting. So think about expanding the mindset of telemedicine to telecare, to providing a lot of the underlying and background logistics, which today we know can be incredibly inefficient. And then think about it again and think about virtual care, which I would define as something that's bigger than telehealth. Now, I've been talking about this probably to myself for far too long. And I was very interested that this gentleman, Tom Handler, who's one of the senior analysts at Gartner, just this Friday put out this great report. If you haven't got it, I recommend you go and buy it from Gartner or get it if you've already got a Gartner prescription, which says, and I'll read it even though you can read it, healthcare providers, CIOs, need to turn the page on telemedicine and create a comprehensive enterprise virtual care strategy. Hallelujah, I said as this thing turned up in my inbox. People are starting to realize that the technology that I'm about to show you underpins something much broader than just telehealth. And if it's really going to have the impact that we need it to have, and the cost reductions and the improvements in both quality and, frankly, convenience, we've got to think about it more broadly. So how should I, if I'm a hospital, think about this? Is this a threat to me? Am I going to have all of my remuneration taken away from me? Is this something that I should embrace? Is this something that I should try and tell my patients that this is a bad thing? Well, as you know, lots of providers are already getting involved in this. But I would say today they've been doing it in a more limited way than I would have expected. So let's talk about their role. We all know about the traditional cure role. I would suggest that today we are not really in a healthcare world, we are in a cure care or a sick care world. As we all know, that's where, not just in the US, but in most countries, most of the money goes. Here's a little trivia quiz for you. Can you name the 2 countries in the world where healthcare costs are decreasing as a percentage of GDP? No wrong answers. Iceland. Well, that actually will be the case, but not yet. Cuba, no. Sweden, very close. Netherlands. Who said Netherlands? I don't even have a prize to give you. I apologize. The 2 are the Netherlands and Singapore. Now, Singapore's interesting that there's a particular governmental infrastructure there and a certain level of kind of compliance with healthcare there, which you don't find in other parts of the world. But the Netherlands one is a really interesting case study. About 12, it might be 14 years ago now, they split their Ministry of Health down the middle into a cure ministry and a care ministry. And they put a lot of the funding into the care ministry. In fact, Netherlands is one of those countries where if you go for an annual checkup, which, by the way, you need to do if you want to continue to have access to the government-provided healthcare, which I think is a very sensible thing to do. It drives me crazy that I know people, one very close from a family perspective, who didn't see her doctor between the years of 45 and 60, and at age 60 is diagnosed with stage 4B colon cancer, that why didn't you go and see a doctor? Well, I had a catastrophic health plan, so it would have cost me a lot of money out of pocket. Why are we not paying people to go and have these preventative measures done rather than charging them to do it? Well, the Netherlands is almost doing that. And also included in your standard healthcare checkup every year is a mental health care checkup. One of the biggest areas of success, particularly in Europe, of virtual care and telecare is in the mental care space. A huge amount of work has been done in this space and some great, great results. And an area, frankly, where we really need to scale what is a very, very scarce resource at the moment. So we might get people to start thinking about care. That might be a broader method. And the Accountable Care Act and what's going on with meaningful use and the changes of payment methodologies, particularly by the government payers, is starting to make people realize that they need to think more broadly about the outside of the walls care of the individuals that they possibly have just discharged. But we're still not seeing as much time or money, particularly in the US, put into the prevent or the engagement side. It's fascinating when I compare and contrast what's going on in the US to what's going on in the UK at the moment, where very large amounts of the NHS's very large budgets are being put into engaging directly with the consumer and using telehealth and virtual care technologies to directly engage with the consumer and try and create the behavioral change before we have to do it as part of a care regime because that person has got sick. And I find it extraordinary that that isn't happening more broadly. But it will. There's no two ways. We all understand the pressure that the system is under. Now, none of this is going to happen if we can't engender some trust. And trust has to be engendered at many, many levels. Dr. Ong was talking to you about Hollywood Presbyterian. Flint is another story, of course. Premera is another story. I mean, there are so many of these stories today. And technologies today have to be trusted not just by the IT department, but by the consumer. And we've got a long way to go to help with that right now. As an organization, I can say we are spending probably more time of my team than on any other project right now than trying to build both trust today and underlying technologies that will build trust in the future. I'll give you an example of this. You may be aware recently of an HHS fine against a hospital down in the southern part of the country who unfortunately a doctor had sent an email to a patient using a non-HIPAA compliant system, there's no need to name it, and a non-HIPAA compliant piece of hardware effectively. And the net effect of this was a pretty fast fine from HHS. I can't remember quite how much theirs was, $443,000, I think. The technology exists already today to stop that kind of stuff happening. I still walk into hospitals too often and see a little yellow sticky on the side of a machine that says, username nurse, password, password. And so what I'm about to say is around cloud-based trust and cloud technologies. We've got to think about this holistically, not just because there's an increasing cyber threat, but because we need to build everyone's trust in these systems. We work very hard at this space. These are all of the current attestations and certifications that we have around the globe. The US, thankfully, is relatively simple. We only have 9 different ones that we have to attest all of our products to in order to make them trusted in this world. And HIPAA is only just the start of it, just to be clear. When I go to other countries, we have to do work like we've just become IRAP compliant in Australia. We've just become BS 1596 compliant in the UK. I'm trying to remember what the specific New Zealand one is that we've just become compliant with. But there is an alphabet soup. But underlying all of this are a set of platforms and a set of technologies which enable telehealth and virtual care not just to be something that's sitting on the side of how medicine is and care is delivered, but right in the center. And I'll show you that in a minute when I show the demonstration. There's another thing that we have to make sure happens to broaden and expand telemedicine into telehealth and telehealth into very broad virtual care. And that is to make platforms highly commoditized, highly easy to use, and highly available. This is an interesting piece of work that we did, not related to virtual care, depending on how you define it, with a hospital in Madison, Wisconsin called Merita. So this is a pretty standard, you've probably seen all these demonstrations before. This is population health management. They're looking at their DRGs, they're understanding where the highest level of obesity or diabetes or whatever, you name it, chronic diseases by geographical region in the city. They're starting to map it against public data sets like where are there parks, where is there access to fresh food, where is there access to fast food, where is there access to the ability to do exercise and gyms and so forth. And as part of that, getting a much stronger proactive plan in how they reach out into their community. Now, the interesting thing about this tool, and I joke with my team, just doing it now, I was down on the show floor at HIMSS, that last year I think what happened was the day before HIMSS opened, everyone in Chicago looked around and a couple of people had population health on their stand. And everyone was like, we need one of those as well. And so whoever was the sign printer in Chicago suddenly got these huge bulk orders for everyone writing population health all over there. Now this, it's another very ill-defined term. This population health tool, if you Does anyone know what it is? Anyone seen this one run before? Would it surprise you to know that you probably already own it? Everything you just saw was done in Excel. So a lot of these underlying tools have to be highly, highly commoditized and usable as well. Because if we start loading physicians and care workers with things that they have to learn, we know what's going to happen. So I'm going to run to the back and give you a little demonstration, if I can do that. And I'm sorry that we probably need to turn the lights up in the room. Any questions so far whilst I'm wandering towards the back? I'm getting some extra steps in. Questions, thoughts? You can keep looking at the screen because that's where you're going to see the presentation. But we're going to plug my laptop in over here. Or my Surface. Did I call it a laptop? I apologize to the Surface team for that. They'll never forgive me. But we do now have a Surface laptop as well, so it could be. Okay. Great. So let me just log in here. Yeah, the password is not password. Well, the other interesting thing on this, I didn't show you just now, but these machines now have facial login. So you can log into these machines with high levels of security, much higher than you would get with a password or even a PIN, which is what I just entered there, by using facial login. Just sit in front of the machine. There are a number of these new devices that have been enabled in the Windows 10 world that allow you to do that. And literally takes seconds for you to do that. Much more secure than a password, much more memorable than a password, of course. If you're like me, one of those people who always remembers a face and never remembers a name. And also, we've tested these with identical twins. You can put identical twins in front of a machine and they cannot log in for each other. So highly, highly secure. So you'll see in the latest Windows machines that are out there today and some of the phones as well that are coming out, facial login will be a very standard part of your world.
Audio in it?
There's we don't need to use the audio. It'll be fine. We'll just take it. So I've got two characters here. You're looking at me, which is great, but what's going on is actually up on the screen, unless you've got amazing eyesight. Dr. Dennis and Laurie Penner, who's one of the care nurses. So what I really want to show you very quickly is how I think virtual care needs to be integrated directly into the everyday life of these individuals. So we're going to let's start with Laurie. And Laurie's going to look at her email like most people do kind of early on in the day. There's Outlook. And one thing you may not be aware of these days, but email isn't just email. It allows you to do groups. So she's going to look at a group that she's in around diabetes care. Now, remember I said earlier that telehealth is not, and virtual care is not just about patient to doctor conversations, but also about making the care team talk better together and work better together. So here we can see, if you just look up here where I'm just pointing the mouse right here, you can see a little green sign next to Laurie. So even in this application, which is a pretty simple application, or indeed even in a website, I'll show you later, we can surface the availability of Laurie to have a conversation right now. So it's green at the moment, which means she's available, she's not seeing a patient, she has complete access to change that anytime she wants to. So she can go in and say what her presence is. She actually wants some particular files to share around diabetes management. She can even look in and use her OneNote application, and all of these kind of work closely together, perhaps even use it to get consent forms from the patient in here. But then when she decides she wants to use Skype and have the conversation with Dennis, who's the doctor. So again, she's having a conversation directly with the care team, not with the patient in this environment. She can click on Dennis. Ooh, there we go. We're going to start a quick conversation with Dennis. I'm not going to show you the sound behind it, but there we are. They're having a nice conversation about this particular patient. You can have the sound if you want. Is that an R? You can turn the sound up if you want. There's a little bit of sound in it, in the conversation. There we go. We're going to make a big noise. Oop, I just pressed the off button. Excuse me. That's my fault. Back we come. So we'll do that again. That's what happens when you put the headphone jack too close to the off switch.
Hello, Laurie.
Hi, Dr. Dehan.
There you go.
I've shared my notes with you regarding patient Peter Wyckoff. He had reported a few allergies, and I just wanted you to take a closer look.
Thank you, Laurie. I'll make sure to take a look and update his charts today.
Thanks, Dr. Dehan. Take care.
Thank you, Laurie.
Hope you like our actors. Now, what's interesting now is that now he was taking that call on his iPhone, Skype call, Skype for Business call, HIPAA compliant, on his iPhone. And then as part of that conversation, she could share that document with him directly onto the phone, get his comments on it, and he could use that directly from inside that same workflow. So not jumping between different systems. Now, the most important thing about all of that is that this experience is one that people are pretty used to with Skype, but they can extend it now into a HIPAA-compliant way. So if you're using ordinary consumer Skype for any type of telemedicine, please stop. Please start using. Please start. You never thought you'd hear a Microsoft person say that. Please start using the HIPAA-compliant version, which is Skype for Business, which is also basically free. It comes with Office 365. If you've already got a subscription to that, you'll have a subscription to this. That is the one where we sign a business associates agreement, and you'll see why that's important in a minute, because the back-end infrastructure means not that we ever look at this data, but and we absolutely don't. That's part of what the BAA says. But we can track what conversations are had, which under HIPAA requirements, you have to be able to do that. So you can understand what conversations have been had, when the conversations were had. You can even record them if you want to do that and archive them. You can't do that with traditional consumer-based systems. So she's had a good conversation with the doc, and we're now going to be Dennis. We're going to be the doc. He's going to open up his browser. And again, immediately you see this is his browser, which is just looking on remember the old world of intranets? Looking on his internal site at Contoso Health, which is where he works. And here's some things that are going on at the hospital. You can see his presence is also put up here. And here he can use Yammer, which is another standard part of Office these days, to reply. Let's just reply to Laurie's question. He can post that document directly so other people can see it. Again, all HIPAA compliant. And then he can go up, search for the specific document, and there it is. So that's all very interesting. But whilst he's doing this, he thinks about the patient themselves and wants to follow up the last call he had. Now, where do most people work when they're doing patient work on a computer? What application are they typically using? Typically, their EMR, thank you. So typically, it's their electronic medical record. It's probably where they spend 98% of their time. So I'm going to show you what it means when you start extending virtual care straight out of the medical record. So I'm going to log in here to this doctor's medical record. And the system you're about to see, if you don't recognize it, is a system called Cambio, which is kind of I was going to call it the Epic. Is anyone here from Epic? I was going to call it the Epic of Sweden, then I thought that would be really rude. This is the main hospital-based, acute-based EMR that you find if you're a doc in Sweden. So we're going to log in as Dennis. And here is his schedule for the day. I'm sorry, it's not particularly readable. It's readable on my screen. And you'll see down here he's got a scheduled meeting coming up with Peter at 2 o'clock down here. So we're going to click on that meeting. And immediately, two things come up. And I'm sorry, it's really small. I wonder whether we can do, this might work, this might not work. No, it doesn't work. Up here, you see that's exactly the same Skype interface, Skype for Business interface, surfaced inside the application. So the way we do this is the back-end platform uses a standard, an industry standard called SIP, S-I-P, and it enables us to surface, no pun intended, these kind of interactions directly inside other applications. And not only can he see and start a call with Peter, which I'm about to do, but also down here, you can see all of the previous calls, interactions, and messages all logged. Again, not so that Microsoft can see it, but so that the care team can see it. So there we go ahead, and we can just to prove it'll work, we can go in and...
Hi, Peter.
Again.
Hi, Dr. Dehane.
I wanted to follow up with you about any questions you might have regarding your next visit.
Thank you for accommodating this call. What would I need for my next visit?
As you can see, it's
For your
entirely
next
natural
visit, which is in
interaction.
1 month, you'll need to follow the nutritional guidelines in the binder. You'll also need to keep track of your water intake.
What about exercise?
Yes, exercise is highly recommended. Remember, for measurable results, you'll need to do cardio 2 to 4 times per week.
Okay, I'll track my exercise then.
Is there anything else I can help you with?
No, that was all. Thank you, Dr. Dehane.
Excellent. Have a good day.
What a polite doc.
Goodbye.
That's how it works every time. Now again, remember that patient could be sitting at home. That patient could be using, excuse me for knocking my microphone, could be using their iPhone, yes, there's a Microsoft person with an iPhone. They could be using an Android device. All of these have clients and the ability to do this entirely within the loop of being HIPAA compliant. So extremely important that we can integrate that idea of virtual care into the everyday environment, both for the consumer and for the healthcare practitioner themselves. Does that make sense? Any thoughts or questions? Because we're about to go into the future now. Okay, you're all excited by the future. If we can go back to the slides, that would be great. Thanks, Tony. So in the last 10 minutes that we have, I'm really happy to keep the lights up. Everyone looks so handsome and attractive and awake. It's great. We'll keep them up. Okay, good. I'm sure we'll have the presentation back in a minute. So what I'm going to do is take you through a few ideas for the future of where some of this technology is going, including real-time 3D virtual care, holographic virtual care, also the ability to use the technology to translate in real time between different languages. Sorry? Well, here's the interesting thing. I think, do you know, I'm actually very glad you brought up that point, because as I was decided to show you this thing, I was thinking, are they going to take offense at this? And what I actually think is that what I can show you is a translation. What you can all do is interpret, and there is a big difference between the two, and we recognize that. I don't think the underlying platform will ever be able to do what you can do as interpreters. I think what will be interesting will be, is there a point at which an underlying real-time translation platform in virtual health can assist and can be part of the overall conversation? Sometimes between the patient and and other parts of their family as well. So again, don't think of virtual. We'll understand how important the family is to the caregiving that's going on. There we go. Look at this. Sorry, I don't think I warned the AV guys that I was going to be jumping back and forward, so it's entirely my fault. Any questions on anything you've seen so far? What questions do you have? Nothing. Everyone's in stunned silence. I feel like I should be doing a little tap dance. If you are coming to HIMSS, do come along to the Microsoft booth if you'd like to. We'd love to see you there. A lot of the stuff that I've been showing you today will be showing in much greater depth. There's also a thing called a consumer immersion experience, customer immersion experience. And you can come and see a lot of this stuff and get hands-on and spend half an hour really working with some of the latest technology and seeing how it all works together. How are we doing? We have 4 people. The other thing we could also do is go back, if you'd like to, we can go back to the Surface device as well, and I can run it from there. So let's start talking a little bit about innovation. Everyone can see me, right, and hear me okay? Good. So let's talk about innovation from a perspective of visualization, first of all. Who's heard of HoloLens in the room? HoloLens. Few people. Okay. So HoloLens is a new device from Microsoft, which actually, if you come to the Microsoft booth, we will be showing. Although I think all of the showings that we have are now booked out, so I've just managed some expectations there. It is an augmented reality device that you wear on your head that enables you to see an underlying substrate of Windows called Windows Holographic. What does that mean? It means you can do everything from playing games in 3D in your own living room to teaching medical students how to look at dissecting a body without a body ever actually being involved. Is that me or you? Okay, I'm just going to stand really, really still. So I'm going to show you a little video, which I hope you're going to enjoy, from Case Western. Case Western is the medical university around Cleveland Clinic, and we're working with them on a big project to totally reinvent how medical education happens. So think about virtual health and telehealth as a way of connecting people together in a virtual classroom, as well as connecting physicians with their patients.
Systems fit together. Using holograms, we can easily separate and focus in on individual systems. For example, we can focus in on the femur, and students can immediately see some of the types of fractures they may one day encounter in the clinic. Now I can leverage all of these new capabilities while maintaining the important connection with my students. When we're both wearing a HoloLens, I can see what they're looking at, what they're interacting with. I can assess their progress, and they can communicate with me and each other naturally. For example, I can see if Michelle has a question in class, or whether Gwen has a question while learning remotely. Now, obviously, a cadaver doesn't move. This makes it difficult to see the way a living body actually works. HoloLens doesn't have this limitation. Systems can be animated to easily see how things function. Let's take a look at the center of the cardiovascular system, the heart. It's an amazing organ. In reality, it's about the size of your fist. With HoloLens, we can easily scale up the heart to let students see minute details. We can even see inside the heart to see the valves in action. This is a new way of seeing things, and it has the potential to help students understand the structure and physiology of the body in a way that's just not possible today. Now, what you've just seen is a vision of how HoloLens could enhance one single subject. But as an educator, it's easy for me to see that it's not just anatomy that could benefit from this technology. This could change how everyone learns. Imagine for a moment some of the other fields that could be changed. For example, chemistry.
So there's a lot more to see on that. If you're interested, just go up and Google or Bing or use whatever you want to look at HoloLens, and you'll see there are a lot of different videos up there, a lot of different applications. But the reason why I wanted to bring it in today is because increasingly we're adding in this ability to do effectively 3D holographic Skype. So the ability to have an interaction, an augmented reality reaction with a patient, because there are cameras on these machines. The other one that is interesting in this space is in some circumstances, we're finding that the interaction with an avatar, you've all seen the film, but with a health avatar gains much more information than with a human being. Kind of like the people who don't want to phone up the pizza joint. There's a guy on my team was just saying to me, I can never phone up the pizza store. I always want to order online. Interestingly enough, some particular demographic groups give a lot more information out to an avatar than they do to a human being. Interesting kind of sociological point. And I'm sorry about the feedback, it's entirely my fault. You can probably turn it down a little as well if you want. I can project. Okay, good. So the next thing I wanted to share with you was this idea of translation. And again, translation, not interpretation. We do not feel any of these technologies that I'm showing you today are about undermining the human aspect of what goes on in caregiving. These are about enabling people to be more productive and enabling us to scale healthcare. There is no way we can get to where we need to get to with the current number of people who are coming through even the best nursing and medical colleges in the world. So this is an example of how Skype Translator works, and I hope you'll enjoy this.
Hi, can you guess where I live?
¿Te encuentras en América del Norte?
Yes. Do you live in central Mexico?
Sí. ¿Te encuentras en Estados Unidos de América?
Yes. Do you live in a capital city?
Sí. ¿Estás cerca de Seattle?
You're very close to Seattle. Are you in Mexico City?
Sí. ¿Estás en Tacoma?
Yes. Very good guess.
Gracias.
Thank you.
Do you like living in Mexico City?
¿Te gusta vivir en la Ciudad de México?
Aquí está muy lindo.
Here is very nice.
What do you do for fun?
¿Qué haces para divertirte?
Voy a las playas de México.
I'm going to the beaches of Mexico.
I like to swim.
Me gusta nadar.
A mí también.
Me too.
Where in the world do you wish to travel?
¿A dónde en el mundo te gustaría viajar?
A Rusia.
To Russia.
¿Y tú?
And you?
Everywhere.
Sería increíble algún día verte en México.
It would be amazing to see you someday in Mexico.
I would really like to visit you sometime.
Me gustaría mucho visitarte algún día.
A mí también.
Me too.
So what's interesting to me about that is that those are the caregivers of the future. You know, either as medical professionals or as kids who are going to be looking after parents. These are the technologies that they're growing up with. They don't look at this and think this is magic. They look at this and think this is, yeah, of course it can do that. Why wouldn't my computer be able to do that? Or my iPad or my Surface or whatever it is. And so you know, we have to think laterally about what's going to happen in the future. And then the final one that I wanted to share with you is some work that we're doing with Dartmouth Hitchcock. Just some really interesting work where they're bringing together, in what I would say is, in the best sense of the term, the best kind of closed-loop care management system that I've seen. It's one that they're actually building called Imagine Care on the back of all of these platforms that I've been showing you today, which brings virtual care, brings the idea of the Internet of Things and the idea of long-term care management really together in a way that I think hopefully will surprise you in terms of what's capable right now. And the first thing that you're going to see, just to lay this out, is someone in a call center, a medical professional in a call center, realizing that the weight of a particular individual who's been discharged post-CHF has gone up, you know, dramatically, and as we know, this is a sign of a possible recurrence or flare, and then getting involved across multiple different modalities using this technology in a very, very efficient and effective way.
Cortana, summarize health status for Ben Andrews.
Ben Andrews' weight has increased more than 2 pounds in the last 24 hours. Please review the home diuresis protocol prescribed by Dr. Phillips.
Patients get reminders and encouragement and dynamic updates to their care plans, improving their health, helping them avoid unnecessary trips to the emergency room, and reducing the cost of care. With support from loved ones and real-time interventions, there is less likelihood of readmission. With Cortana Analytics Suite and Microsoft Dynamics, we're transforming the way healthcare is delivered today, improving patient outcomes, reducing costs, and offering an unprecedented level of personalized care.
That's my alarm telling me I need to go. So you can see how you can combine all of these technologies together in a way that really hasn't been seen before. And this broadly is, I think, what's being seen in the US as the second race. If EMRs were the first race, we know what they've done, we know what they haven't done. We've really got to start thinking about these underlying technological platforms to get us there. So I'm pretty much done. I really appreciate your patience with the technology today, or specifically the presentation. And thank you to the great team at the back for helping out. I really appreciate you for doing that. Hopefully that's interesting. Hopefully that showed you how we can think beyond telehealth, beyond telemedicine to telehealth, beyond telehealth to virtual care, and how the platforms are around today. You know, everything you saw in that last video, including the lady speaking back and the lady querying Cortana Analytics, those are platforms which are available today. There's nothing in there that isn't a shipping product. Skype, the underlying translator, is something you can go and play with for free today. It's available on multiple different platforms in multiple different languages. Even Chinese, I think, now has just gone out there as well. So you'll see how, whilst we're not trying to create, as a company, end-user solutions here, we can create a lot of value in the underlying platforms, both to customers and to those who are developing those solutions. I hope that's of interest to you. Thank you so much for your time.